Hey guys, welcome to the Handlebar. Today I want to talk about a simple shoulder evaluation technique that I've been utilizing the handlebar to really help classify patients with shoulder pain either into a mobility or mechanical capacity issue where there's soft tissue or joint restriction, mechanical restriction in their ability to move their shoulder versus more of a strength or stability issue, simply called a mobility issue or a stability issue. So let's say I have a patient who comes in who complains of anterior shoulder pain with reaching overhead. Their pain is in that mid-arc of motion, and they might also have a little bit of pain trying to sleep at night. So they describe their motion as painful through here and again painful at the top of their range in the front of the shoulder. Diagnostically, we're thinking either some kind of rotator cuff issue, maybe some impingement in the shoulder. In order to address those issues, we want to classify it further to see what they might benefit from in treatment. So mobility problem or stability problem, the first thing I'll do in my assessment most times is just going through active range of motion. So I'll have them range through shoulder flexion, shoulder extension, external rotation, horizontal adduction, some functional testing as well, and see which one bothers them most. So right now we're talking about having pain with shoulder flexion in that mid-arc of pain. So they had pain with shoulder flexion. Next thing we'll do, we'll hand them the handlebar. Simple enough. It's in that same flexion pattern. We'll hand it to them here, and we'll ask them to create some tension. So all I'll have the patient do, stand tall, pull your hands apart, and slowly lift up over your head. I might play also with positioning and have them in a wider scaption plane and see if that decreases the pain as well. I'll have them pull their hands apart, and then I'll have them push their hands together and see if that changes the pain at all. Now, let's say that they still had pain when they create tension, when they contract different muscles of the rotator cuff during the pattern. So let's say that they have pain. So if they're that painful patient, I'm most likely going to classify them into more of a mobility classification, a mechanical issue, meaning that they'd probably benefit most from soft tissue mobilization, joint mobilization, nerve glides, and stretching preliminary before we do more of our activation and functional strengthening work. But let's say if they do that handlebar push together, pull apart, and they have no pain with that, that means that they'd most likely be more of a stability patient, that they benefit more from isometrics, progressing through isotonics, open chain handlebar exercises and other exercises, and closed chain exercises. So utilizing the handlebar, you can quickly, by creating tension in the same pattern as they have pain in, really deduce whether it's more of a mobility problem or a stability problem, and then plan the appropriate interventions throughout their plan of care.